Now, I don't know about you, but summer is right around the corner, and if you are dreading showing off your legs because of those unsightly veins, sometimes even painful veins, there is something you can do about it. Dr. Paul Sauce is here from Optima Vein Care with more on this. Good morning, Dr.
Good morning,
Sauce. It's
Lisa.
Good to see you.
Good to see you, too.
Yeah, a lot of ladies, we see it a lot, the ugly purple stuff. Why do we get those veins? Sometimes they're bulging, too.
Women are especially exposed to venous insufficiency, so they're affected more than men.
Yeah.
Plus, they have several periods in their life where these things come out. During puberty, we were talking, when they take birth control. When they get pregnant, they've had a few children, these things tend to get very bad. And
a lot of it's hereditary? Is that true?
Most of it's hereditary, and then, additional stresses. If you sit a lot, stand a lot, you get more of this problem. It gets worse and worse.
And besides the ugliness of it, there can be symptoms that you actually have if you have those really bad varicose veins, right?
This is a serious medical problem. It's not cosmetic. It's not aesthetic. This problem leads to heaviness in the legs, aching in the legs, restless legs. It aggravates certain other pathologies. Just even swelling of the legs should motivate you to come in and get seen in their office.
I think so many people think, oh, I just have to live with it, but you don't have to any longer. We have some before and after pictures we wanted to show.
Good.
Talk about some of the treatments that you can do. I think many women have heard of some very scary type treatments out there, but it's not like that.
No, this has completely been transformed. It's all done in the office. You come in, you continue your regular activities. You can get these procedures done very quickly.
Wow.
There's no downtime. It's very effective. Patients just are surprised at how easy this is to get treated.
Yeah, I'm looking at these before and after pictures, and that's some serious. Is that what you would call a varicose vein?
We're lucky because patients see what this problem is. When they come in the office, they've already self-diagnosed. You don't have to do a blood test or anything. They come in, they show you their legs, and this is the problem. This is pretty simple. These are not the worst pictures. We get guys as well as women. This is not just a thing. The guys need to, come in and not be embarrassed. And this is, before and afters. People come in with just horrible things, and in a few treatment sessions they leave, and they're astounded, how fast this is and easy this is to take care of.
And you said they feel better. I mean, they're
legs feel
surprised
better, the swelling goes away. Yeah, there's a lot of benefits to having this taken care of.
And look, I think this is where kind of it all generates from, is that ankle, right?
It can get very bad, yeah. That's where the pressure's the worst. When the system is not working, that's where the pressure builds up, and that's what leads to the varicose veins and the spider veins and the swelling. So we treat that source of what's actually going on, and you get a cosmetic benefit at the same time.
Can it be dangerous if it's left untreated?
These will bleed. People have serious complications. They can get ulcerations in the skin. They can get bleeding. They get blood clots. This is serious. This is a serious medical condition. It's probably the most prevalent one that's out there.
Wow, yeah, don't ignore that at all. And you said, too, that you can do the minimal ones, like let's say the spider veins, so all those kind of things. You can cover it all. Does insurance cover a lot of this?
If patients are having symptoms, the insurance will cover it, and we can go in and just explain that to the patients. We typically have to see the patient, do an ultrasound to determine whether it fits the category if something is treated by insurance or paid for. About 90% of what we do is paid for by insurance.
Now, describe a typical day. Somebody comes in, is it an outpatient thing? Can they go to work the next day?
Well, patients for the diagnosis come in. We do the ultrasound when they come in. So after you've been in the office about an hour, we can tell you what's causing your problem, what treatment plan we would suggest to you, what the insurance will probably participate in. And then all these treatments are done in the office. The longest is a laser procedure. It takes about 45 minutes, an hour. And then subsequently, it's typically, a half-hour appointment. And depending on what you have, you come in and we take care of it progressively.
All board-certified physicians doing the work on your legs.
Yes, everybody's trained in this pathology. Everybody has a lot of experience. We've all been around a long time. It requires some skill sets, and it requires, some experience.
Absolutely. Very nice. And there's something you need to know, too. If you go in, there's a free consultation. So you can come in and say, take a look, what do I got here? And then you'll know where you're at, right?
Patients are more than welcome to come in, have a free consultation or a free screening.
Okay.
We do the same thing we typically do during a regular appointment.
Gotcha. Thank you, Dr. Sauce. Really
Thank you,
good
Lisa.
information. There's 3 locations, by the way, if you want to go check out Optima Vein Care. There's Chandler, Scottsdale, and Phoenix.
In Phoenix,
3 locations.
yes.
So if you want more information, you don't have to walk around and be embarrassed any longer. Go to OptimaVeinCare.com or call the number on your screen.